Good afternoon, viewers. Welcome to again another contribution to the UT's Week of Inspiration, a week that traditionally precedes the DS of our beloved university, and in which speakers of international and national fame talk about their fields of expertise. This contribution is supported by the student associations of our health sciences program, Sirius, the student association of our psychology program, Dimensie, and of course, Studium Generale. My name is Pascal Wilhelm. I'm a senior lecturer in social sciences at the Atlas University College of Twente, and I will moderate this session. The science of psychology has shown that human behavior is affected by expectation. Expectations can influence your experience, your emotions, and even your behavior. As an educational psychologist, I was intrigued by the finding that when teachers hold certain expectations about their students' performance, this can not only directly influence their teacher behavior in class, but it can also indirectly affect the student's performance itself. So, believing in yourself, expecting that you're able to deal with new challenges in life, actually fosters meeting these challenges. And I see that in my students every day. But can expectation also affect your health? Can it make you feel better or even worse? Our speaker of today is a leading expert in the field of the placebo effect, the illustrious curing health effect of holding positive treatment expectations. It is my honor to welcome Andrea Evers. She's professor in health psychology at Leiden University, and she's also affiliated with Delft University of Technology and Erasmus University Rotterdam as a medical Delta professor. She was trained as a clinical psychologist and cognitive behavioral therapist and is still holding practice. She got her PhD with honor in 2003 at Radboud University. And he started as a professor on somatic conditions at the same university and is currently holding a position at Leiden University. He's also a member of the Royal Netherlands Academy of Arts and Sciences, and in 2019 she received the Stevin Prize for her work about which she will speak today. Professor Evers, are you ready?
Yes, of course.
Well,
Thank you.
The floor is yours.
Thank you so much for this great introduction. I have to share my screen now. Let's look. Yeah. Here, can you see my screen? And I will start the presentation now. Great. Thank you so much for inviting me to give this lecture or hear this inspirational lecture at your university. It's really an honor for me to be here and to talk about my favorite topic, and it's a topic about the placebo effect. And why is the placebo effect so fascinating for me? Yeah, of course, I'm a psychologist, but I'm particularly a psychologist who's interested in the body-mind relationship. So how our mind can influence, for example, our bodily responses. And the placebo effect, I think it's a perfect model to explain a little bit about these relationships. But the placebo effect is, of course, also interesting because it has such fascinating effects in clinical practice. We know all about the placebo pills, a fake pill that might have an effect on several outcomes, like, for example, less pain or other things. So it's also fascinating from a clinical point of view. But from a psychological point of view, it's even more interesting if you think in terms of that expectancies play a huge role here. And I will, of course, go into detail into these aspects. But let's start. What do you know about the placebo effect? Of course, it would be wonderful to ask you some questions now, but that's not possible today. But I think you know the placebo effect, for example, from this discussion of antidepressants. It was in the 90s that there was a lot of attention for this topic because several researchers did some meta-analysis and showed that placebo effects are as effective as antidepressants. Now we know that it's not always the case because if you're very depressed, then an antidepressant has an additional effect, that's really sure. But on average, it is indeed the case that placebo effects are as effective as antidepressants. And the reason is, for example, that many persons with mild depressive symptoms are also prescribed antidepressants. And then antidepressants are usually not so effective, or at least placebo effects are as effective as antidepressants. However, that's not only the case for antidepressants, it's only for painkillers. This is, for example, a publication in Nature 2 years ago. And there were a lot of concerns that our painkillers are not effective enough anymore, and the placebo effect, it's becoming more and more important. And indeed, it's true that when you look on average what the effectiveness is on painkillers, you see large placebo effects. But even more, even here in surgery, it's in knee osteoarthritis. What they did some fake surgeries here. And of course, you can have some ethical questions about it, whether it might be a good idea to have a fake surgery. And I totally agree. But from a scientific point of view, of course, it's fascinating that what they saw is even the person that had the fake surgery had the same recovery rates than the patients with the real surgery. Okay, then you can ask, of course, a lot of questions. Why are we doing these surgeries? And I totally agree, but that's a discussion perhaps for later. Of course, you know all these discussions about alternative medicines, that in alternative medicines there's a lot of attention for communication, and those usually the professionals give a lot of hope to patients, and that alternative medicines might be particularly a placebo effect. There is some evidence that shows that might be the case, but the problem here in this area is that there's not enough research to really prove this. So we need much more research in this area. But yeah, I'm convinced that indeed, usually they make a lot of use of communication techniques. So this might indeed be true that the large effect of alternative medicine is part of the placebo effect. So if it's so effective, then there might be a reason in a way to prescribe it as a regular medicine. Of course, this is a nice discussion we can have later. I do not totally agree that this might be the best way, but perhaps it's nice for the Q&A. So if you have any questions, please send it to us. So what I will talk about what is the placebo, and the opposite of it's a nocebo effect, the neurobiology, then the conditioning responses, and some clinical implications. The placebo effect, what it is. In fact, what Pascal already said, it's about expectancies. It's a beneficial treatment effect that is in fact not really due to a treatment mechanism, but only because this patient has some positive expectancies regarding a specific therapeutic effect. Like, for example, the pill the doctor prescribes, and the doctor says that, I promise you a lot of positive and beneficial effects, or I believe that this will work for you, that immediately has a placebo effect. Or you might remember yourself and only thinking about the well-known painkiller that always worked in the past, that only when you think about it, you already feel less pain when you start with headache, for example, the day. These are typical examples for the placebo effect. And this was one of the first very nice experiments showing experimentally a strong placebo effect in a very easy and clinically applied way. What they did is they prescribed drugs, in this case painkillers, in the case that the patients knew about it, and in the other conditions that patients did not know anything about it. So they were not informed that painkillers were prescribed. And here you can see the results of one of these trials, or other trials have similar results. You see in the red line, it's a strong effect, but it's only when the patient knew about the prescription. And the blue line is when the patient did not know anything that they received the painkiller. So clearly a very strong placebo effect. And the blue line, of course, showed that it's a painkiller here is absolutely ineffective. That's not always the case. It differs from between drugs, but it's always what we find is that there's much stronger response when patients know that they receive a painkiller. So the red line here. So I have several questions also for you, because it's nice to make it a little bit interactive and that you try to answer these questions for yourself. For example, here the first one. People usually think that in children the placebo effect might work better than in adults. And the reason is, for example, that they have more fantasy, that suggestions work better in children. Now, that might be the case. So perhaps you agree with this question. However, other people sometimes think, no, that is absolutely not the case, because they have less learning experiences. So they have less experience, for example, with a painkiller. So placebo effects might work less in children than in adults. And we have to do much more work in this area. It's always important to say that, of course, in children, it's usually more difficult and more complex to do the same research. So much less work has been done in children than in adults. However, when we look at the evidence, then we see that placebo effects are on average or even effective. And it might be the reason that indeed there might be more suggestions might work better in children, but at the other side, they might also have less experience, for example, with specific medication and other stuff. We do not know for sure for this moment. But what we see in average, that there are no differences, that children has on average the same effects as adults. Another interesting question is then whether placebo effect might also work then in animals. Because when you think of, for example, the way how placebo effects are induced, it's a strong communication effect. For example, that the doctor says that something might work. So a general question is it also possible that placebo effects are an unconscious effect, and that might also work in animals? Interesting discussion. Perhaps we can continue it in the Q&A and later in the discussion. But for now, I will give you the answer already. So there are indeed placebo effects also in animals. And the reason is that we learn also in an unconscious way, and the most important learning process is a conditioning process. I will talk about this later. And animals can be easily conditioned. Like, for example, Pavlov's dog, you might know from the conditioning process. And one of the most interesting experiments, I think, there is in animals about placebo effect is this study in rats, where they exposed two groups of rats to pain, and they used the painkiller in one group and no painkiller in another group. And then they were followed by a placebo treatment. And the interesting thing is what they saw is that the rats showed less pain behavior. Of course, you can't ask a rat about pain, so you observe then the pain behavior. They showed less pain behavior in the group that previously received the painkiller. So we're only receiving a placebo. So that's, of course, very interesting to show and to see here that it is possible indeed that these rats learn and that they learn a placebo effect, and that they also show these placebo effects. And it's very interesting, of course, how this works then, and I will come to this later. Are there also negative effects of a placebo? Of course. Every placebo effect can also have a negative effect, but the most well-known negative effect is the nocebo effect. It's in fact a little bit the opposite of the placebo effect. The nocebo effect is a negative expectancy, and it induces a negative treatment effect. So it's not, of course, again attributed to the treatment mechanisms itself, but only due to expectancy someone reacts negative. For example, the idea that you always react hypersensitive to medications, and that people react in a specific way, that, for example, are very anxious about adverse events and side effects. So this is a typical nocebo effect that might be due to only negative treatment expectancies. And the first evidence for these nocebo effects were found in clinical trials. And these are one of the examples, the first meta-analysis where they summarized many studies. And what they did, then they looked at side effects patients reported only in the control conditions. And in the control conditions, of course, they received only a placebo, though you wouldn't expect any side effects. However, what they saw is that people reported the same type of side effects and the same number of side effects. And that's, of course, quite interesting. That they, for example, reported nausea where it was only a placebo. Well, in the instruction letter, for example, it was warned for nausea effects. So what they saw is that people were informed about these effects of possible side effects, and they typically showed precisely the same side effects. And not only the same number, but also the specific type of side effects. And this is, of course, very fascinating and has been replicated in several other conditions. Have you ever read a leaflet or an instruction letter of medication? Of course you have. And yeah, then you can imagine that you will be not very happy when reading this leaflet because, yeah, there's so many side effects mentioned. And it's not really clear that there's a very low risk to have these side effects, so to suffer from these side effects. So indeed, you can imagine, for example, the results of this study showing that only reading such an instruction letter reduces the willingness to take the medication. And one of the most well-known nocebo effects are in the area of clinical area, for example, of chemotherapy. When, for example, in the area of cancer, for example, women with breast cancer have to receive several chemotherapies, and usually what you see is they react with a lot of nausea. And nausea is really an awkward symptom. And what you see then when they start with a second chemotherapy, that they develop already nausea symptoms before they start with the next chemotherapy. And of course, this physical reactions is not really a reaction of the chemotherapy, but it's a learning process. It's a nocebo effect that the body already reacts with a negative reaction. Another example, what's really very clinically relevant, is in children with juvenile arthritis who also take medication like methotrexate. Methotrexate is an anti-inflammatory drug. And what you see is that these children frequently develop side effects before taking the drug already. So, for example, when they have to take the methotrexate at Thursday, let's say already develop nausea symptoms on Monday. And it really happens very frequently, and it's really a huge problem in clinical practice, for example, for rheumatologists. So we know that there's really a strong nocebo effect in clinical practice, but this is perhaps also very interesting. But it's also in daily life in a way. So these effects, of course, are not only relevant in care processes, but also for your symptoms, perhaps, for example, what you hear in the media. We know, for example, that if we talk only about corona, people are much more afraid of getting corona, of course. Every symptom you see, particularly every media attention, leads, for example, to a higher registrations in general practices and higher reports of the same symptoms. So, in fact, all the information we have, and particularly the negative information about diseases, symptoms, and everything, has an immediate influence also about the probability that people report these symptoms. And of course, it's not only a subjective report, but it can be also a physiological reaction, what I previously showed, and I will go to this detail further now. So summarizing, its placebo and nocebo effect can have a huge impact on daily life, on adherence to medication, but on recovery processes, morbidity, but even on mortality, because we know, for example, that chronically negative expectancies like pessimism or hopelessness can also have a higher risk of mortality in epidemiological studies. So what's about the neurobiology? I will only shortly talk about the neurobiology. But then one of the interesting questions is here, of course, is placebo effect a symptom that has particularly an effect on your subjective symptoms, the self-reported symptoms, or does it also really have a neurobiological mark or certain such an immune system? It's a nice discussion. And the answer is that indeed it has stronger effects on the subjective complaints, but there are clear effects on the biological markers also. And I will show you some examples. What's important about the neurobiology? I will only very, very shortly go into detail here. But what's important, the first thing, is that placebo and nocebo effects are different processes. The placebo effect, for example, we thought that it was, for example, a rewarding effect, and there were some studies showing a dopamine reaction, which is, for example, very important in Parkinson and other diseases. While a nocebo effect is much more a stress reaction, an anxiety response. You are worried about side effects, and that's a typical nocebo response. That's much more, cortisol, for example, is much more response that is related to nocebo effects. Now we know much more from brain research, a lot of the brain areas that are related to the specific processes in pain, because there's most evidence in pain about placebo and nocebo reactions. I will not go into detail, but you see that the different areas, for example, the emotional and the motor axon, the prefrontal cortex, are involved in its responses. And we know that the several physiological systems are also involved, like the immune system, the cardiovascular system, and so on. But how does it work then is, of course, the interesting question. How is this possible, of course? In fact, it's a learning effect, and that makes it so interesting also for psychologists, because we know a lot from learning. In fact, the two main learning processes play a role. We have much more learning processes, but these are the most important. The first one is, you can say, a communication aspect, this verbal suggestion. So what you give, for example, some instructions to the patients that it might work, or you talk about side effects. What you see is that particularly in nocebo, it works quite strongly, because negative information is we know much. We have much more attention for negative information than for positive information usually, and that can have a strong short-term effect. However, this is more a short-term effect. And the most important principle of the learning is indeed the conditioning effect. It has really much more stable and long-term effect. And the conditioning is also responsible for the automatic responses, and that can have these physiological effects. And we know conditioning, of course, from Pavlov's dog. And why it's such a nice example? Because Pavlov's dog produces saliva, and that's a physiological response only when hearing the bell. And because the expectancies of the dog are to get some food. And this food is, of course, the expectancy, so a positive reward, you can say. So the bell is something that had no meaning in the past, but now by ringing the bell, the dog produces some physiological responses of the saliva. So it makes it very clear that it can be a bodily response. And that conditioning is also a process that might be also possible in every type of animal. Here are some examples of the conditioning process, like the traffic light, what I said, that it has, of course, it's a very nice example of conditioning process, traffic light, that we all stop for the red light, or the white coat, that has the real meaning, of course, for all of us in the care process, and usually a positive meaning, that this gives trust that there's an expert, and we hope to that he will cure ourselves and help us with our complaints. So The interesting thing is then to know more about it, why this effects occur, to learn whether this might also have an effect on the bodily reactions. We are doing, for example, many research studies in the area of pain or itch, and that's of course very important, but there's no time now to show disease examples. But I will show you some other examples which might be even more fascinating. Now we come to the immune conditioning and how this can have a physiological effect, for example, on the immune system. And these, of course, are very, very fascinating studies. What they do here is that they give a medication, like a drug, like cyclosporin. Cyclosporin is an anti-inflammatory drug, but it's also used, for example, multiple sclerosis or other severe conditions, and they combine it with a condition stimulant. For example, here a drink, a strawberry milkshake, for 3 days. And after this, 1 week later, they only give a placebo together with the milkshake. So the milkshake is here the same like the bell with the Pavlovs dog. And what you see is that the same immune conditions, immune responses, then they are shown here. And that's, of course, very fascinating that these responses can be conditioned after a week. Another example for a very fascinating study here is in the area of insulin conditioning. Insulin is, of course, very important for diabetes and others. A little bit different design. What they did here on day 1 is they combined insulin with an odor or placebo with an odor and give only a placebo. And what they saw here is that on day 1, of course, you have clear insulin response, the black line. That is, of course, clear because they gave insulin, but the second day they only gave a placebo. And here you see the same insulin response. And that's, of course, very fascinating that this insulin response is, in fact, the placebo effect is a conditioned response. So very nice examples for physiological effect. So what are the clinical implications? Of course, there are many clinical implications. What does mean? What's most important about it, that in fact the whole context is very important. The main implications of the placebo effect is that not only the drug and not only the treatment, but the communication, the verbal suggestions, the place cues, social cues, the non-verbal language, the treatment cues, what you offer, but also the background of the patient. All are important for the treatment success. And I will give you some examples shortly. One is the patient, that you might focus on treatments of the patients, or the professional, or the medication. And one of the most interesting questions here is usually upon whether openness about the placebo effects might reduce therapeutic effect. Because you might think that if people talk about the placebo effect and know that they receive a placebo effect, it might not work anymore. However, if they have still positive expectancies, it still might work. Here's a nice study to show that it might indeed work if people know about the placebo effect and if they have at least some positive expectancies. What they did here in patients with irritable bowel syndrome, they have a lot of, they suffer from stomach pain and so on, and usually there's not really a cure for it. So in these patients which really suffered from chronic symptoms, they prescribed placebo for 3 months. Of course, after detailed information about the placebo effect. And what they saw is really impressive results on the pain, but also on daily life disabilities. So it was really a very nice and very impressive example that even if people know about the placebo effect, it can work. Should we do this in practice? I'm not sure, but it's a very good example that it can work. And the same they replicated in patients with chronic low back pain. They did the same. They informed patients that they received the placebo effect regularly for about 3 months, and they saw really huge improvements in pain and restrictions in daily life. So a very nice example that even if people know that they receive a placebo, it can work. If the placebo effect is so important for patients and the nocebo effect, is it then not important that patients are informed? In a way, it seems to be not ethical not to inform patients. But I'm curious about your opinion. However, if we need to inform people, then of course we should also give attention to the communication and how doctors communicate with the patients. Yeah, this is indeed what we indeed recommended. We organized 2 conferences now in 2017, but the next one in 2019, and developed expert consensus with best scientists in the world in this area. And generally, from 2 conferences, the most important recommendations were, indeed, we know so much about the evidence about placebo and nocebo effect that it has such huge effect on clinical practice. It's really not ethical not to inform patients. Of course, it's not necessary to mention the placebo and nocebo effect always, but inform people and train professionals then. And what type of treatments then would be an idea to do? I'll give you one example, for example, for the patient, how we can foster the positive expectancies. For example, what they did here, they prepared people for heart surgery by not focusing only on the negative aspects of the heart surgery itself, but much more focusing on the long-term perspective, what they want, why are they undergoing the heart surgery, what is the reason for them. For example, my goal is to work again, or to play with my children again, or other stuff. So, and when people focus more on the recovery process and the positive expectancies, then they had a better recovery afterwards. So that was a very nice example. What might be an example on the doctor-patient communication? Of course, there's always a problem that we have to inform people about the risk and side effects to prevent these nocebo effects. So it's we want to prevent nocebo effects, but at the other side we have to inform people about the risk and side effects. So that's difficult. However, this might be a nice example. For example, here in the first group, what they did during a medical procedure, they said you feel a hard sting and it's a worse pain. In the other group, they said, oh, we will give you a painkiller and you feel comfortable. And of course, both are very ethical. But what they saw is that in the second conditions, they had much less pain. So usually you have really 2 alternatives, and it's really possible to have another communication in a way that less nocebo effects are induced. While warning for specific side effects usually has a negative effect, so that's not the best strategy to warn for specific effects because it increases the chance of getting these effects. And this is an example for a nice strategy where patients with a little bit unexplained symptoms, people that attributed to the windmill syndrome because they live near to a windmill, they were informed about the nocebo effects. And what they saw is that people then had less complaints afterwards, so that it can have a positive effect if you explain a little bit more about these effects. And I can give you later several examples that these nocebo effects might indeed be important to inform people about these effects, and that might immediately lead to a decrease of these effects. So what are the most important recommendations here is, of course, to ask first people how they want to be informed. Of course, we have to inform people, but you can always ask people how they would like to be informed. There are always several options here. And of course, we should have attention for people who have very fear of side effects and have a higher risk of it. If you want to emphasize the placebo effect, then it's nice to look whether you can explain the treatment mechanisms, because people usually do not really understand why something is prescribed. And that is really pity, because if you want to foster the placebo effect, then it's very, very important. And people have an idea why something is prescribed, and to explain the treatment mechanisms might be a very important thing. But also to emphasize then the positive long-term benefits of the treatment. Because in the short term, of course, you never know what the next effect is, but think about the long-term benefits of the treatment might also foster the placebo effect. But never forget that the placebo effect, of course, is based on trust. It's So there, an open, trustable atmosphere and relationship is really most important. So that is what you always should remember. The placebo effect, in a way, is a trust. So I will finish with perhaps the most challenging, but also most interesting, most fascinating application, that is pharmacotherapeutic conditioning processes. Usually we give the same dosage of all medications, and that is the doses with chronic conditions, for example, we usually prescribe always the same. However, in terms of conditioning, that really not make sense, because in terms of this conditioning, you would prescribe first a high doses and then a lower one. That's a conditioning process that can work. And then you repeat sometimes the same doses, that it is still the conditioning effect might work here. But you can lose that then after a while. Of course, you have to repeat it sometimes, because otherwise you see that the conditioning process will extend. So this principle has been applied to several clinical studies, and there were fascinating results that it might seem to work, that this conditioning scheme might work for this type of patients. But of course, there were not enough studies to really apply this already in clinical practice. So we do need much more research, but the trials are there that are really promising. I would like to finish here that what you see is that the pharmacological effects, of course, would be largely reduced, and we could also have a lot of effects for less side effects and smarter use of drugs. And that's it. Thank you so much.
Okay, well, thank you, Andrea, for your very interesting presentation. I've received a few questions now, and I think they are still rolling in, right? Oh, no, okay. So let's just see what we have got here. This is a question by Femke. Thank you,
Yes.
Femke, for your question. And she's asking, is the placebo effect actually the same as Pavlov's theory? So maybe in more scientific terms, can the placebo effect be explained fully by the principle of classical conditioning?
Yeah, it's a very good question. And that's, of course, not the case. Conditioning is a very important process to explain the automatic and the physiological responses.
Okay. The question by Femke was, can the placebo effect be fully explained by the principle of classical conditioning?
Yeah, of course. No, that's not the case, because all learning processes, in fact, are responsible for placebo effect of these expectancies. And an important learning process are, for example, verbal suggestions and communications, what I said. So that was what we call instruction learning. But for example, also social observation learning plays a role, that you can observe, for example, someone who take a pill and that the pain is relieved. For example, you observe your parents and that they have a lot of benefit from specific painkillers. Yeah, and then a child learns, for example, placebo effect. So all learning processes are also responsible for a placebo effect, but conditioning is in this sense the most important, because it's the most substantial effect on the unconscious processes. And of course, the most fascinating is here the bodily responses, for example, the immune conditioning. So to have an effect on the bodily symptoms, you need probably conditioning always, we think, at least at this moment. But for the more subjective effect, you have, for example, communication and observational learning and other stuff.
Okay, so what you're saying is actually that there are more learning mechanisms involved that can explain this effect. Yeah. Okay, thank you. Another interesting question here by Patricia. Thank you for your question, Patricia. She states, because the nocebo effect is so clear, should doctors not tell about the side effects of medicine? And shouldn't we just forget about all these long lists of side effects that come with medicine?
Yeah, that's of course such an interesting question. Ethically, it's absolutely a problem not to inform people about side effects. It's not possible. People have the right to be informed about possible risks. But I totally agree. We shouldn't give too much attention to it. For example, we know if I know go in detail about all these side effects, then people indeed have a higher chance to develop these side effects. So it might be, for example, an alternative to inform people first about the nocebo effect, so that they are really well informed about the possible negative effects of too much information. And then they take their own decision how they will be informed. For example, you could say, people, if they worry, we know that if I tell you a lot about possible adverse effects, there's also higher risk to develop it. So it might be, for example, an alternative that you have, that here we have a website when you can have a look if there are some symptoms, but only in that case. But we do not really focus now on the symptoms. So there might be several strategies doctors could choose to induce less nocebo effect. But in fact, at this moment, it's not yet general practice. So that's really a pity, and we should have a lot of more attention for this alternative communication strategy.
Okay, thank you. Yeah, and from this example, it becomes evident how your work can be applied so well in practice. So that's in that sense, it's a very interesting question. Thank you, Patricia. So our next question is from Aleida, and she states, if you're open about the pill you receive being a placebo and it works, why not just then give children fake sweets?
Fake sweets?
Yeah. Better for your health.
That's a good idea. Yeah. That's that is a new one. Yeah, fake sweets. Yeah. First of all, why only giving it to children? Why not in adults? I generally think that it's not fair to apply the placebo effect more to children than to adults. In fact, but that's a nice discussion. I think it's particularly an ethical discussion whether we would like to have to receive a fake pill and whether this is necessary. Let me take the example of this study of the open placebo trial in chronic pain. These patients were happy with it, but I'm convinced that the placebo effect can be also induced not only with a fake pill, but what I showed that can be induced. Of course, it's an expectancies effect. So we can use it, we can use everything for it, but it's not necessary to have a pill. The pill only works so well because in our society we have the positive expectancies about the pill, particularly due to the pharmaceutical industry. If we would focus less on medication and drugs in our society, we would also have less positive expectancies. So perhaps it's not the best way then to give to reinforce this effect, but also giving also more and more fake pills, but better to induce a placebo effect in another way. But of course, with sweets, it's attractive and it's a nice idea. If we inform the children about the placebo effect, I think it's fine. So if you inform people that, you're only taking this pill because we know that it might work better than, for example, in adults, for example, to lose weight, why not? And then if it's their own choice, why not? But then we all agree that this might be ethically okay to do, and the patients or the citizens themselves or the children themselves also make a conscious choice for it. And then I think it's fine. And then it's a psychological method that can help us, for example, to lose weight or to increase our expectancies. And why not working a little bit with imagination of ourselves?
Yeah, I see what you mean. Yeah. It's interesting to hear that there's also so many ethical considerations involved in your research.
Yeah.
So it seems that our questioner here, Aleida, has inspired you for some new lines of research. So it's good to hear. Our next question is from Annemarie. And she states, could you also apply the positive effects of your own expectancies of feeling pain, so without using a painkiller? So could you sort of,
that's precisely, that's a very nice question, because that's precisely what I mentioned, that we do not need this pill, but in fact only the expectancy works. For example, if you have this white coat, a doctor with a white coat, and you have really trust in this specific doctor because he has very positive expectancies, It's not important whether he or she prescribes a pill or does something else. It's really because you have some positive expectancies. Or if you have positive expectancies, usually you have positive expectancies of your own experience, your own positive expectancies from the past and your own experience from the past. That's a conditioning effect. So everything, when you have positive expectancy effect, it induces a placebo effect, and you can work and you can use it also for your own health. So, for example, that only when you think of your yoga course, you already feel much more relaxed, or only when you really believe that something helps, is supportive for you. Yeah, this will indeed induce a specific placebo effect. So, and this placebo effect is reinforced when you have, again, more positive experiences with a specific technique, for example.
Yeah, and if you talk about techniques, are there already like practical applications of this phenomenon?
In fact, every coaches or self-management programs make use of these expectancies effects.
Mhm.
For
Yeah, they say,
example, that they
believe in
try.
yourself. Yeah.
No, but they try, for example, to give you a immediately rewarding experience that induces some positive expectancy. So on, yes, I can do this, and let's see, and it works. So some immediately rewarding and motivating effect that immediately induces, in a way, some placebo effect.
Yeah, see what you mean.
So that is, for example, very important when you start a new thing. So take care that it's fun, it's positive, and it's rewarding, and you're motivating. We know all from self-management that these principles are so important.
Yeah.
But also, for example, in marketing, of course, they make a lot of use also in a negative way from these principles. That suggestion a lot of placebo effect in marketing and using a lot of positive expectancies that when taking a specific pill or something, you get more energy and you're a nicer self and you are more attractive, and inducing the whole day long a lot of positive expectancies. And then I think it's not, then you have really can ask some questions about the ethical applications, but it works. We know that it works. Yeah.
Yes. It's interesting to see that your work touches on so many aspects of life. Basically, it can be applicable to many areas of life. Here's a question by Bram. Thank you, Bram, for your question. I remember that you talked about trust in your presentation, and this question is also about trust. So the question is: fake news leads to less trust in science and government. Shouldn't be there a decline in placebo effects too?
Yeah, that's a good one. I think there's not enough research in this area about fake news and what might be the effects of placebo and nocebo effects, but I'm sure it can have a strong effect. The problem of trust, of course, in everything of our society. Our whole society is based on trust, of course. And if we indeed have more fake news and do not trust and do not really believe and have these positive expectancies, it might be a huge effect on how we interact in our community, how we follow and believe everything from the government. An example, a new leader, like, for example, Barack Obama, he started with, yes, we can. Mm-hmm. Yes, we can. I think, in my opinion, is a very strong placebo effect. And a lot of votes, I think, were responsible because of this placebo effect. And the opposite is, of course, fake news. Fake news, if you do not trust the government anymore and your leaders, then we really have a huge problem in our society. Of course, in a way, we always need also a little bit of positive placebo effect to be motivated and to be enthusiastic and so. And yeah, I think it's very interesting to study this phenomenon.
So it also touches on hope, basically.
Hope, If you're vulnerable and in the hospital and you can't trust anymore your doctor, It's very terrible. It's a terrible situation. And of course, it's the same for fake news. We are so depending on these, our society is based on trust and on these principles that this might work. So, I'm really afraid and concerned about the negative effects this might have on Nocebo Effect, like extreme ideas that nobody can be trusted, complot theory and complot theories, for example, what you see in this COVID, that might have huge effects on our whole planet, in fact.
Yeah, no, I share your concern here. Yeah, it almost seems like fake news is the virus that sort of kills our hope, basically.
Yeah.
The next question is by Elise. This is actually a little story. Elise, thank you for your question. She states, when I was little, my parents always gave me a pill when I was coughing. It worked really well because it suppressed every cough after that. So it worked. But now, will it work while I'm older?
Oh, that's a question.
Yeah.
That's no problem, because if you still have positive expectancies, then it's fine. And that is the thing with the fake aspect here and the discussion about the open placebo. That some people say, no, open placebo will not work because it's a fake pill, and if you know that it's a fake pill, it will not work anymore. However, that's not true. Because if I explain to you, and I have explained to you now in my lecture, that the placebo effect can work, so now you have positive expectancies about the placebo effect. So this might probably work for you now, because you know how it works, and that can be also a placebo effect. It's not necessary that you have this really a substance in it for the effect. So in the case that there are positive expectancies, placebo effect can work. So it's a little bit indeed your own choice, whether you believe in this placebo effect by yourself also, and you would like to make use of it, or you say, no, I don't like it, I don't want to have a fake pill, so I don't believe in it, and then it's also fine. That's a bit that's here a personal choice. But if you think that the placebo effect can work for you, and I know, for example, for myself, of course, the placebo effect works for me. Why not? It's perfectly that I make use of it for myself and for my own health.
So you're saying if you're open and receiving on placebo effects, it might work just as well.
Of course, because if you are convinced by yourself that it has kind of positive expectancies, and of course the important thing is here the unconscious level also. That's the reason, for example, why positive suggestions might not work immediately, frequently, because it's more that you really have a long-term positive experience, like you was a child, and it always worked for you. Then it can have a huge effect. If it's only one positive suggestion, like one yoga lesson, something like this, of course it's not enough, and then it's a very short-term effect, and then it's not very convincing. The conditioning process is here crucial, that it has a long-term effect.
Okay. Professor Evers, we need to close this session now. May I thank you for your very interesting contribution and your intelligible responses to our viewers' questions. So thank you from
here.
Thank you
so much. It was very nice to be here.
Okay, so thanks again, and and good luck with your very interesting work for the future. For our viewers, stay tuned and have a nice day.